What part of the bowel is most often affected by Crohn's disease? A. The terminal ileum. B. The sigmoid colon. C. The ascending colon. D. The rectum. The answer is A. The terminal ileum. While Crohn's disease can affect any part of the alimentary canal, the small intestine, particularly the terminal ileum, is the most common site of serosal inflammation. What is the characteristic mucosal alteration seen in ulcerative colitis? A. Thickened mucosa. B. Skip lesions. C. Cryptabscess. D. Granulomas. The answer is C. Cryptabscess. The characteristic histological alteration seen in ulcerative colitis is the cryptabscess, in which inflammation causes loss of goblet cells due to neutrophilic exudate in glandular lumens. Granulomas, thickened mucosa, and skip lesions are all seen in Crohn's disease. Frequent projectile, non-bilious vomiting starting 2 to 3 weeks after birth is indicative of what condition? A. Intussusception. B. Infant gastroesophageal reflux disease, GERD. C. Congenital hypertrophic pyloric stenosis. D. Diverticulitis. The answer is C. Congenital hypertrophic pyloric stenosis. In congenital hypertrophic pyloric stenosis, the smooth muscle of the pylorus becomes thickened, decreasing the lumen size of the pylorus. This prevents food from passing out of the stomach and into the small intestine, resulting in vomiting, which is often projectile and tends to be non-bilious. Intussusception may show vomiting, but the more obvious sign is bloody currant jelly stools. Infant gastroesophageal reflux disease, GERD, may result in frequent spitting up, but projectile vomiting is rare. Diverticulitis is generally a condition of the elderly and tends to present as abdominal pain with alterations in bowel function and mild fever. What comorbidity is generally seen with esophageal varices? A. Gastroesophageal reflux disease, GERD. B. Achalasia. C. Hiatal hernia. D. Cirrhosis. The answer is D. Cirrhosis. Esophageal varices are most commonly seen in patients with cirrhosis due to portal hypertension. Gastroesophageal reflux disease, GERD, is associated with esophagitis and occasionally with metaplastic changes. Neither hiatal hernia nor achalasia are associated with esophageal varices. What sign might indicate Hirschsprung's disease in a newborn? A. Unrelenting crying. B. Bloody stool 3 to 5 days after birth. C. Vomiting within 48 hours of delivery. D. Failure to pass meconium within 48 hours of delivery. The answer is D. Failure to pass meconium within 48 hours of delivery. While an infant with Hirschsprung's disease may have vomiting and bloody stool, the most common sign is failure to pass meconium within 48 hours of delivery. Hirschsprung's disease, which is an absence of innervation to the large intestine, which results in narrowing and constriction of one part of the bowel and dilation of the preceding segment, can be diagnosed by biopsy of the distally narrowed segment of the bowel.